All right. Well, welcome to those who are joining us. We're so glad that you can be here today from wherever you're Zooming in. I'm Dr. Leah Jeanette, and we're just excited to be able to talk with you a little bit more about the topic of ethics in the hospital. I think it's such a relevant topic, not only coming out of the pandemic, but for those of us in the world of bioethics, it's something we're constantly talking about on a regular basis. So to get us started, I just want to go over an agenda. We'll talk a little bit about Case Western Reserve University, where we are in the School of Medicine. And then we're going to launch into actually talking about clinical ethics and ethics in the hospital. We'll talk a little bit about our master's program and do an overview. We'll talk about the application process and deadlines, student assistantships and financial aid, and then do a Q&A at the end. If you have questions as we're going along, please feel free to submit them. There's a Q&A box that you should be able to submit your questions in, and I'll keep an eye on those, and we'll either answer them as we go or we'll save them to the end and be able to address those. So I want to welcome Dr. Mark Aulisio, and he is going to be primarily leading the webinar. And I'm going to let him introduce himself more specifically in terms of his role and his relationship with clinical ethics. So Dr. Aulisio, thank you so much for joining us.
Well, happy to be doing this with you, Dr. Jeanette. My voice is a little hoarse from yelling for the Cleveland Guardians. But you know, they won the game I was at, and it was amazing and exciting, but I'm still recovering, and they're out of the postseason hunt. Anyway, my background is actually in analytic philosophy, going back to graduate school. But coming out of when I went to graduate school, I was interested in medical ethics, clinical ethics, and I did an internship. I was lucky. With an ethics consultation service at the Cleveland Clinic when I was a master's student. And over time, that internship led to my first position at the University of Pittsburgh, leading a national task force looking at ethics consultation in clinical settings and the kinds of core competencies that folks who do ethics consultation should have. And really since the mid-90s, clinical ethics has been my specialty area, both in terms of clinical responsibilities, doing consultation, chairing an ethics committee, doing education in clinical settings, and helping with policy formation review, but also my publishing and research is all in and around clinical bioethics, and I really couldn't be happier. My responsibility shifted a few years ago from, emphasis on clinical ethics, and then, working in and around academia to primary responsibilities as chair of this department. But I still maintain a pretty strong presence in clinical settings, both at Metro Health Medical Center, one of our affiliates, one of our 4 affiliates, and University Hospitals Cleveland Medical Center, another one of our affiliates. So I'm really happy to be able to do this webinar with Leah, who is one of our graduates and who also is really focused and specialized in clinical ethics. So Leah, tell them about yourself.
Thanks. As Dr. Aulisio said, I'm actually an alum of the master's program. I was class of 2009. Because of this program, I decided to actually go into bioethics, and I went on and got my PhD in healthcare ethics and focused in clinical ethics. And around the time of graduation, a position opened up here at Case Western Reserve, and I've now been here, almost 6 years. In addition to being a clinical ethicist, I also am in administration within the department and do some teaching responsibilities as well. But like Dr. Aulisio, having that connection to the clinical world is invaluable. I think for me, it adds so much more to teaching and being able to bring cases into the classroom. And I know students particularly love having cases to discuss. So yeah, so that's a little bit about us. So I'm going to move us forward. And our department of bioethics and where we're located is within Case School of Medicine. And I think one of the great things about where we're positioned, not only within the School of Medicine, but across the university is, of course, the School of Medicine is nationally recognized for its medical research and medical education, but we have a lot of interdisciplinary and interprofessional and cross-university relationships. And so there's a lot of collaboration going on between the School of Medicine, the School of Law, College of Arts and Science, engineering. I mean, you name the school at Case and we have projects going on and grants and relationships, and it's amazing. And that's just within Case. Expanding beyond that, as Dr. Aulisio mentioned, we also have our affiliate hospitals here in Cleveland, which we'll talk about a little bit more because our students also have the opportunity to be in those hospitals. So it's, you know, Case Western Reserve is an amazing place in the relationships we have within the bioethics world, but also interprofessionally is pretty amazing. So Dr. Aulisio, I want to, pose the question to you. What is ethics in the hospital? If someone asked you that question, kind of what would you tell them and what would you talk about with them?
Well, it's a great question. And at a very, basic level, clinicians of all types face ethical issues, daily in their practice areas. And most of them, they handle really well and they deal with, right? But then there are things that come up that are kind of, people are less sure about. And there can be disagreements, value conflicts, uncertainties about what to do and why. And sometimes those reach a point where you need an outside set of eyes and ears and maybe an outside voice to sort through the issues. So when you think about clinical ethics, when you think about ethics in the hospital, you probably think about end-of-life decisions. You think about, palliative care. You think about the role of family in decision-making, patients' rights, good pain management. You think about informed consent or informed refusal, right? Informed choice, confidentiality and privacy issues, resource allocation. I mean, we're trying to get out of this darn pandemic. I just got my latest bivalent booster. That's another probably impact on my voice and overall energy level. Along with the flu vaccine, but we're resource allocation of scarce medical resources in the time of COVID, for the last 2 years been a big issue, whether it's ICU resources or vaccine prioritization or other things, right? I mean, we've dealt with an awful lot, and you've seen that, I'm sure, as you've paid attention over the last few years. We're all sick of COVID. I'm in that club too. Other things, when you think about clinical ethics, you can have beginning of life issues. I mean, look at what is going on with reproductive health questions, right? And you have everything from very, babies, pregnant women, to peds with intensive needs or multiple needs, chronic care issues, all the way up through adults, and even, into geriatrics, right? So clinical ethics, you find a clinical case, you scratch it, and you're going to find an ethical issue. It might not be one that needs formally addressed by an ethics committee or a consult service. The ethics committees typically education, policy formation, review, and consultation. There's usually a service connected to a committee in some fashion. That's kind of the threefold function of formal clinical ethics in a clinical setting. Not everything needs to go there, but you scratch any case and you will find value-laden issues. It's just the way it is. In fact, we like to illustrate this with a simple hypothetical. You have to humor me. My philosophical background has to creep in once in a while. And I like to use this case. I've published it using it, and I've presented, I use this in a lot of presentations. It's to really illustrate just how value-laden healthcare decision-making can be. So imagine that We're on the other side of winter. It's the first warm day of spring, and a motorcycle accident victim is brought into the ED. But the motorcycle accident victim, per my storyteller hypothetical, is alert and oriented, doing really well, seems to be really have with it, right? And here's what the patient, the motorcycle accident victim, is faced with. You can take a vein or an artery, whatever, out of the wrist, the right wrist, put it in the right leg just below the knee, and there's an injury to the right leg. You'll be able to save that right leg just below the knee. Or the team can leave the wrist alone, but over time, the right leg is going to get worse and worse. That's the expectation. And probably the patient is going to need amputation just below the knee. And the patient is approached with these options. Everything is explained as would be required in a good informed consent process, right? And the patient says, whatever you do, don't touch my wrist. If we have to amputate, I understand. You go, well, what the heck, right? That's a peculiar choice, right? Well, of course, it's the case is contrived. It's to illustrate a specific point. Turns out the patient's a concert pianist, and a minor disability in the wrist, which is what the patient was going to have if they did the wrist procedure, is something the patient wasn't willing to take the chance of, even if it meant losing, his leg below the right knee. Value dependence, best treatment for this particular patient doesn't look like best treatment probably for the people on this webinar or for Leah or me, but this kind of thing happens, and it happens all the time. And yet this patient has a right to live by his values. This is a value-dependent decision. And if this is value-dependent, what looks like a medical no-brainer, like, of course, you save the leg, right? What isn't, right? So value conflicts and uncertainties, value-laden issues run through and through all of healthcare practice, and certainly in hospital settings. And clinical ethics is kind of turning your attention formally to the identification, analysis, and attempted resolution of those value conflicts or uncertainties. Oh, so here we go. Dr. Jeanette did a great job with the slides. You can see complex value-laden issues emerge in the delivery and practice of biomedicine and life sciences. One way of defining bioethics and medical humanities, so clinical ethics, kind of a subset of that, is working to identify, analyze, and resolve such conflicts or uncertainties that emerge in different areas, right? It can be the clinical setting, it can be the research endeavor, it can be other areas of biomedicine. And what we think here at CASE, and one of the reasons we have a multi and interdisciplinary department, one of the reasons we reach across not just the School of Medicine, but CASE and through to our affiliates, is that these issues are sufficiently complex, sufficiently value-laden, that we need a bunch of different lenses, to use that language, to look through, to better understand and appreciate what's going on and how we might move forward to make things either a little less bad or a little bit better, and not miss something, and inadvertently take a difficult situation and make it worse. So this is, in a nutshell, our approach to bioethics and medical humanities. Okay, so why study clinical ethics and bioethics and medical humanities? Well, I mean, honestly, if you're interested in it, it's worth studying. If you're not interested in it, then probably you shouldn't anyway, no matter what your other motives are. But the fact of the matter is whatever your trajectory is, if it's in and around healthcare, there is, the value of developing skill in naming, identifying, helping to analyze and resolve these value-laden issues, is that value in and of itself is tremendous. And I'll tell you that our MDMA students, who are dual degree students, you tell us year in and year out that when they go for residency interviews, that most of the time in the interview is spent talking about bioethics. And they like that because it's like, hey, that picked us out of the group. But the fact of the matter is that the bigger picture, or you might put it a different way, the deeper value-laden issues are so fundamental that if you're kind of a thinking person and you don't want to just be sort of the narrow technician, you want to be, somebody who is engaged in the human side of medicine and with human beings in your research and in your practice. Bioethics and medical humanities is a very, very good complement to a professional degree, or a very good on the way to a doctoral degree. Okay, yeah, interdisciplinary, sorry, and multidisciplinary in its origin and practice, yes, for sure. We help to launch students. Our students do really well, and we're proud of that. We're extremely proud of that. We've had students go on to PhD programs and thrive. Some of them rejoining us, like Leah. We've actually hired some of our own PhD students, like Professor Aaron Goldenberg, who's a graduate of our program. He was also an MPH at University of Michigan. But we've had lots of students also, kind of carve out a niche in professional areas that really work for them, a bioethics niche, a medical humanities niche. And then, of course, the traditional route of maybe you go on and you decide, I don't really want to be a health professional per se. I'm interested in hospital ethics, but what I think I want to do is I think I want to be a clinical ethicist, right? Well, there are a lot of different ways to become a clinical ethicist. There's not just one preferred path, but all of those paths are certainly opened up by our program and programs like it. So, I've not had anybody come back to us and say, gee, that year I spent in bioethics and medical humanities, I wish I hadn't spent it that way. What I have had is med students who don't do the program, who go on, become doctors, say, you know what, I've settled on, I think everybody should probably have to do a program like yours, which is interesting. I've also had retired docs who came back and did our program, but several actually, Leah, one who's adjunct faculty with us right now, who said, everyone going into the health professions would be benefited by this. So anyway, be that as it may, we're proud of our program, and we are very, very confident that whatever your trajectory, we can help you kind of calibrate that trajectory, and we can help you find your way. We do have students who find, a job after the master's. We didn't design the program to place students with a master's degree. It's not designed as a terminal degree, but actually, especially in the research ethics track, we've had a lot of students end up with IRBs or program analyst at NIH or other roles with the AMA. We've had several students. So, there are different paths, none preferred over the other. It's not like there's a one right way, but we'll find one of those paths and we'll help you walk along it.
I think that's one of the great things about the program, and that students appreciate, is that not every student in the program is on the same career path. And so it makes
Right.
for really great discussions in the classroom. It makes for really great perspectives, not just from the people who are teaching the classes, but actually from the students themselves, because they're thinking based on their educational background, but also where they're headed in their career as well.
A great point, Leah. And sometimes students they'll do a gap year, right? And it might be something you're thinking about, because you're not entirely settled. And we have students who kind of discern, a somewhat religious term, but discern during this year, and they decide, you know what, where I thought I wanted to go, I don't want to go. And then we've had folks who are quite certain they want to be X, Y, or Z, and they change their mind, which is also okay. Anyway, that's part of what our program is there for, is to kind of help sort things out for folks along with enhancing.
So along those lines, I think it's great to kind of highlight some of the great features of the program. So this fall is our 27th year. We are one of the oldest in the country. And so we are constantly reassessing and making sure that we are, teaching what is relevant to students and getting feedback and kind of making sure that, the curriculum and all of that is fresh and relevant. The program can be done full-time or part-time. Most students do it full-time, and it takes 2 semesters, so 9 months, which fits really well, as Dr. Aulisio talked about, fits really well into a gap year for a lot of students. The curriculum is 30 credits, but it really allows for customization. So 13 and a half of those are electives, and that can include short-term study abroad courses. And we have some other courses we'll talk about in a little bit as well, including our clinical ethics rotations. All students are going to have an advisor assigned to them, and we base that on your interest, where you think you might be headed. But of course, every faculty is available to students, beyond just who you're assigned as your advisor. And as kind of been referenced a little bit, we have dual degree options. So for students who are pursuing their MD, JD, an MPH, an MSW, a degree of master's in genetic counseling, there are options to also do our program in addition. So lots of great opportunities within the program itself. And the one other thing that I think is really unique about our program is we have our traditional program, which means students take the core courses, including our Foundations of Bioethics 1 and 2, and the clinical ethics rotations, and they write their capstone, but then everything else is left to electives. But some students are interested in, as you can see, either medicine, society, and culture, which is a medical humanities concentration, or research ethics. And so they can really do a further deep dive into those areas as part of a concentration within the program. And it really allows for students to focus in on what interests them within this world of bioethics and medical humanities.
So if we labeled the traditional program, we'd probably say that's the bioethics concentration, right? The medical humanities concentration is MSc, Medicine, Society, and Culture. Research ethics concentration, a subset within bioethics, a specialization type of concentration. But this is a nice diagram that captures it, I think, well.
And I know, since we've been focusing a lot on clinical ethics, primarily in our discussion, I think it's important to highlight specific opportunities, both course and research, that students can dive into this clinical ethics topic. So we'll talk about rotations in just a second. I keep talking that we're going to talk about it. It's the next slide, I promise. But our clinical ethics theory and practice course is a great deep dive into this world of clinical ethics and really understanding the nuances, the history. Dr. Aulisio has been leading that course for many years and really does a great job of teaching both, as it says, the theory and the practice, but also bringing in clinical ethicists from the area hospitals who are doing this work as well.
I told Leah she's had to say I do a great job, so.
But I think one of the other great things about, focusing on clinical ethics is we bring, as we've talked about, we have these affiliate partners in the hospitals. And so there are clinical ethicists that come to the classrooms and teach. You could write your capstone paper on a topic of clinical ethics. And of course, students can get involved in research, whether it's clinical ethics focused or other areas as well.
There was a question that came in through the chat to that effect. Actually, we've had students end up on either research grants or part of unfunded research. We've had students who've published papers with faculty. We make sure that there's appropriate credit and division of labor. but it's generally the faculty person helping the student get a publication. And I mean, I've done that myself. Dr. Anderson has done that. Dr. Goldenberg has done that. Dr. Younger's done that. I mean, we are very committed to education, even as a research department in a research school of medicine, and we're really committed to advising and mentoring.
Absolutely. So I think one of the hallmarks of our program, and this is the piece that we get feedback from a lot of students about, is our clinical ethics rotations. So this is an opportunity for students to be inside our teaching hospitals here in Cleveland. And as we've said, we have 4 affiliate partners: Cleveland Clinic, Metro Health, Lewis Stokes Veterans Administration Hospital, and University Hospitals. And each of these allows our students to rotate throughout those hospitals in different ways. So you have rounds with different teams, you have committee meetings, and you also can go one-on-one with healthcare professionals. And by the end of the program, for students who do the 2 semesters, you get 160 hours minimum, which is an amazing opportunity. You get to see the breadth of what these hospitals offer, the specialization within these hospitals, and really consider the ethical issues that healthcare professionals face, that families and patients face, in many different ways. And on a weekly basis, you can sit with other students and someone from the site you're assigned to and talk about what you've seen and experienced, and really dive into those clinical ethics topics.
Yeah, you have site-specific preceptors. And one of the things our program is pretty unique in having 4 major teaching hospitals as affiliates. And, we're lucky because the School of Medicine has those affiliates. But the other thing is that these teaching hospitals allow our students to do rotations in their hospital settings. And that's a big, big deal, because it's not easy to open access, especially to people who aren't just health professionals in training, right? So this is something we're proud of, and we've built it over the years and grown it. And I think it's actually in as good a position as ever been in. So, and now that we're coming away, getting out from under that cloud of COVID, the in-person rotations have returned, and things feel a little more normal again. And I think we appreciate it a lot more than we used to now that we're able to be back in person. By the way, behind my background here is our health education campus building, which is a joint effort of the Cleveland Clinic, one of our affiliates, and the School of Medicine. And it's really for the education of folks who will be going into the health professions. And the idea is that with all of these folks using the same state-of-the-art building in the same space, hopefully intermixing in not in classes, but socially, and then in some formal intermix, that interprofessional engagement will grow, and that we'll have better teams long-term in healthcare settings. Anyway, this is the image behind me. It's the Samuel, what is it? The Samuel, is it the Mather?
Simpson Pavilion.
Simpson Pavilion. Sorry.
Yeah, there
you go. The Simpson Pavilion.
Yeah. So for those who are, interested in applying, the application process is fairly straightforward. Once we receive your completed application package, which includes transcripts, your personal essay, what we're looking for is, why are you interested in bioethics and medical humanities? How does this fit into your career path? Looking for a CV or resume. This should actually be 2 letters of recommendation. Sorry for the typo. And once we have that completed application package, we then are going to interview you for the program. Every applicant is guaranteed an interview for our program, because we want to get to know you. We want to make sure that we understand your interest in the program, but that our program is also the right fit for you. We feel like there's a mutual fit that needs to happen in order for students to be successful in the program. And so that's really important to us as well.
Yeah, there should be a good fit. If there's not, it's not going to work for you. And that's the most important thing, but it's probably also not going to work for us. So we do really dial in on that.
Just to kind of highlight financial aid, we have a program called Student Assistantships, where students can get involved in teaching, research, or administrative opportunities within our department. Students receive a partial tuition waiver for this. If you're interested in learning more, we're happy to talk about this in a separate conversation. And of course, we have the traditional financial aid office as well, which are really great at working with students and pointing them in the right direction. In terms of timeline and deadlines, we're taking applications now. Our priority 1 deadline is December 1st. What that means is if you have a completed application submitted by December 1st, we'll render a decision by the end of December, so before the year has ended. Beyond that, we have various application deadlines into the spring semester, and our final deadline would be August 1st. For a fall start. I do want to give time if there are questions. I know we had one pre-submitted question, which I think is a great one to kind of think about. So the question came in from someone who's thinking about medical school in the future, and it said, as future medical students, how are we able to participate in the process of medical ethics decision for patients? I think that's a very loaded question, but I also think it's a really great one.
So you'll do it. Okay. So mainly you'll do it in thinking through clinical cases that are either based on actual clinical cases or actual clinical cases. And it will help you develop a facility in thinking through, okay, what are the major issues? What are the steps I should take? How might this be handled, right? What has worked and it worked, right, in certain cases, and what hasn't. The other thing that'll happen is when you do clinical rotations, we ask you to identify, we're not asking you to, be out there to make sure everybody's behaving, right? We're not the ethics oversight or the ethics police, but we do ask you to be looking at the cases you see and identifying potential ethical issues, making a note of it, jotting down some notes, and bringing back to your weekly discussions what you see and raising the issues there. And then you talk through them with a site preceptor from that site, so from that hospital, and that will definitely help you. It's really interesting to hear folks who've gone on tell us about how the program has contributed to their practice. I mean, we have folks at the clinic, we have folks at UH, we have folks at Metro, all of whom who've done our program, and the VA who've done our program, and they tell us, yep, this really helped, including the person I mentioned who thinks everyone who goes on to the health professions should do something like this for a year. But, it's just a long answer to a complex but important question.
So another question came in that was asking about letters of recommendation. So this says, can letters be reused from other graduate programs, i.e. medical school, or is it recommended that applicants submit novel letters of recommendation? So
yeah, go ahead, Dr.
So I would say, in general, what we're looking for in those letters of recommendation is someone that is exactly what it says, is recommending you and your ability to do grad level work. They can speak to your character and your ability in a classroom setting or a research setting, or can speak to knowing you, and that they believe that you can succeed in a master's program. We understand that sometimes asking for multiple letters can be from the same people for different purposes can be challenging. And it can be time consuming. And so we would permit you to reuse those letters. given that you're usually waiving your right to see them, you may not know what they contain.
Yeah.
And so that can be the kind of tricky thing. And so I think it's important to also talk with your letter writers,
Right.
to understand what you're asking for and potentially where you're applying. And so I think that can also be a discussion you have with your letter writers.
Yeah, so that's a great point, Dr. Jeanette. Sometimes letter writers are uncomfortable if a letter that they wrote, say for med school, is directed to a different purpose. Usually it's not going to be a problem, but they should know. And then there are times, so like if you applied to case medical school, they're not allowed to take your letters and send them to us, even if you tell them to. Right. And it's funny because we could sit on the admissions group for case medical school, right? We could be interviewing students, but there are some very strict firewalls. So you need to make sure you've sorted that out with your letter writers for sure. Okay.
Yeah. Yeah.
Don't want any miscues, any misunderstandings there.
So we have one final question before we wrap. So it says, thank you for the informative presentation. If you're willing to share this information, what's the acceptance rate for the program?
We don't keep it, but I'll tell you what our approach is. Our approach is that if you're qualified and you're a fit, we want you in the program. This is not like it, so we haven't designed this to be only 8 get in a year or only 10. We're given that it's master's level and given that we actually think it's really valuable for a pretty broad group of folks, we've deliberately gone the other direction. So the issue will be, do you meet our criteria? And then do we think it's a good fit? That's what will determine whether you get in or not.
And if you have, specific questions about your application, your circumstance, I would highly encourage you to email us, bioethics@case.edu. We'd be happy to have a conversation with you about your specific circumstance. So we can talk about your chances of getting in the program and the fit itself, even before you apply. So you have a better sense of, your application, what we call kind of pre-screening. So I would encourage, any interested applicant to do that.
Yeah. If you have doubts or concerns, just reach out to us. We're good about turning it around, and we'll be honest with you. We better be.
Well, I just want to say, it's been great, talking about these topics, and for anyone who's interested in, furthering the conversation, please, as we've said, but email us, bioethics@case.edu, whether it's myself answering it or forwarding it on to the appropriate person within the department. We'd love to continue the conversation. Thank you, Dr. Aulisio, so much for joining us.
Thank you, Dr. Jeanette.
And I hope that
all.
Yeah, I hope that those who attended found this valuable to them today. So.
And Simpson Pavilion, I want to make sure I got it right. Okay. All right.
Have a good evening.
See you guys. Bye.